A strain to the hammies can be really, really painful. A lot of times after an injury, they can get really tight, especially when you try to stretch the leg out. Luckily, cupping is an excellent tool to reduce the pain and tightness and improve function after a hamstring injury. Before I even start, I like to make sure that I focus my treatment on and around the ouch area. One way to find the ouch area is to manually resist knee flexion. So we'll put her in a flexed position and have her actively try to bring her heel toward her butt. And we are going to resist that. Usually that will produce an ouch sign, and we'll say, where did it hurt? She'll point to actually exactly where we put the cup. And so we can put her back in a resting position, and then we are going to focus our dynamic strokes over that ouch region. So I am going to just kind of friction that area and make sure I iron out all those adhesions. I can do some doorknobbing in this area too, but the hamstrings are pretty thick, so I actually like to go in there with a more aggressive stroke, and I will do that frictioning. So the hamstrings produce knee flexion. We found that ouch sign, the patient pointed to it, and then we were able to focus some dynamic strokes in that area. I like to use some dynamic strokes like straight line cupping parallel to the hamstring fibers, or like I showed you, you can friction directly over the ouch sign in order to reduce those adhesions and reduce pain. Give that a try, and then we'll do a couple other techniques for the hamstrings. My favorite way to treat the hamstring is to place the client first in a hook lying position. From there, you are going to have the client take hold of their knee by grasping just above the popliteal space or on top of the knee if that's more comfortable. Then you are going to apply edge cups statically over the hamstring where you felt tightness or where there was an ouch sign. I'm going to kind of load her up with edge cups. If we had more cups, we could use more cups. If we only had one area that was super painful, we could just always use one cup. Less sometimes is more. Do what's best for the client. I like to use the edge cups for this because I like how they take up a good amount of tissue underneath the cup, which is exactly what we want. Have the client now extend the knee to actively stretch the hamstring from this position. Ooh, perfect. Try not to allow that leg to go down into a neutral position. We're going to keep that client at a 90-degree hip flexion and a little bit more than 90 degrees at the knee, and then we're going to try to actively extend up toward the ceiling. Good. Once she's taken up about as much as she can with that stretch, we're going to hold that stretch for about 20 seconds. After 20 seconds, we can now bring that leg back down, allow that hamstring some time to rest and recover. And then, of course, we're going to rinse and repeat. We're going to go right back up into knee extension. And I'm just bracing here to make sure we don't lose a ton of hip flexion or knee flexion in the process. Perfect. Good. So like I said, they can hold the stretch for about 15 to 20 seconds and then repeat that 5 times or so to improve flexibility and tissue mobility in the hamstrings. From this same position, after you have put the cups on the hamstrings, you can now passively extend the knee, support the entire leg as you passively stretch the hamstrings by keeping the leg in a straight leg raised position. When you feel a decent amount of resistance, you can have the client actively, with about 30% of their power, attempt to extend the leg down toward the table. And again, we're going to resist this motion. Good. So she's going to press down for about 5 seconds. And after 5 seconds, we're going to tell her to relax. Then you're going to wait about 2 seconds for that muscle to turn off, and then passively take that stretch up even higher until you feel a good amount of resistance again. And then you're going to have them rinse and repeat. We're going to have them bring that leg down toward the table. Resist, 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 and then relax. Wait about 2 seconds. We're going to take her further up in that stretch. And because it looks so good, we're going to do it one more time. Press that leg down toward the table. Resist, 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 resist. And then relax. 2 seconds. And then we're going to bring her further into that hamstring stretch position. All right, that was beautiful. Give that a try. Last but definitely not least, from the hook lying position and then with the knee secured by the client, you can perform dynamic cupping over the hamstrings, especially the ouch areas, just like we did when they were in prone, except now we have taken it a step further and the hamstrings are on a bit of stretch. We can use our frictioning. We can use our doorknobbing. Or we can use our straight line, either parallel or perpendicular to the muscle fibers. We can use all of those strokes. I usually go parallel to the muscle fibers when I do the straight line strokes, but this is definitely a good way to get in there and be super specific while getting some good stretching of the hamstrings. Parallel strokes usually lengthen or help to lengthen that muscle. So if we're going for a lengthening of the hamstrings, I like to use a parallel stroke. But if we want to get in there and address adhesions while keeping them in a stretch position, then I would go with more of a perpendicular technique right across the muscle belly of the hamstrings. Give all of those a try. Try them on both legs.